Medical professionals, have you ever treated a patient and immediately recognized a previous doctor's errors? A 25-year-old U.S. soldier, who I will call Sam, was brought to our trauma unit after getting shot in the abdomen with a high-powered rifle, maybe .50 cal, judging by the entry wound. Miraculously, he was alive, barely. He'd been taken first to a tiny rural hospital where, with no trauma surgeon on staff, a team of general medicine residents and an OB-GYN stepped up to save his life. They got him into surgery fast and managed to patch up some bowel injuries and stop what they thought was a mesenteric bleed. They even left in chest tubes for drainage, improvising what they could. It worked, sort of. 5 days later, septic and crashing, he was transferred to our major trauma center. When we got him, he was in rough shape. Fever of 104, heart rate 140, blood pressure tanking. His midline incision was leaking green and brown pus, and the chest tubes in his abdomen were still draining foul fluid. The one-page op note described injuries to the small bowel and proximal jejunal mesentery, which they had clamped and ligated. Our CT scan told a different story. A bullet was sitting in his colon. Nothing in the note said a word about that. In the OR, we found disaster. The colon injury had been missed. Repairs had failed. The mesenteric bleed was actually a torn branch off the aorta. Large chunks of bowel were necrotic. We had to remove his colon, resect more bowel, and create an ileostomy. His abdominal wall and backside were devastated by necrosis and pressure wounds. We did what we could. Despite it all, he fought. His family was incredible. He made it to a better-equipped hospital for reconstruction, but 2 months later, we got word he'd passed. I still think those residents did everything they could. They were in over their heads, but they bought him a chance. And sometimes, that's the win.